Hello everyone. So today's topic is functional column of cranial nerves. So as you know, during the development of central nervous system, we have seen how the neural tube was divided by sulcus limitans into dorsal part, that was alar lamina and roof plate, and the ventral part, the basal lamina and the floor plate. So here we already know the cells of the alar lamina going to form the sensory nuclei and the cells of basal lamina going to form the motor nuclei. Now here the nuclei of the cranial nerves, again I am repeating, in the alar lamina the nuclei will be sensory nuclei, so we can call them the afferent, and here they will be the motor nuclei, so we call them efferent. Now if we see here, more closer to the sulcus limitans, there are visceral nuclei, so that we can say these are visceral efferent and these are visceral afferent. And away from the sulcus limitans, nuclei are somatic, so we can call that somatic afferent and somatic efferent. So here we are able to see somatic, motor, efferent, and here we are going to see general, visceral, efferent. On the alar lamina we are able to see the visceral sensory nuclei, so we can say general, visceral, efferent, and away from the sulcus limitans those are the somatic sensory, so we can say general, somatic, afferent. Okay, so but here this roof is expanded, widened, so you can see here the alar lamina now present on the dorsolateral aspect of the basal lamina. So but here the demarcation is because of the sulcus limitans, so you can see here again close to the sulcus limitans in basal lamina there will be visceral motor nuclei, so we can say general, visceral, efferent. So what are the general, visceral, efferent? These will supply the glands, smooth muscle of viscera and vessels, and also they will be supplying the preganglionic parasympathetic fiber, that is general, visceral and efferent. And on the alar lamina close to the sulcus limitans there will be the visceral sensory nucleus, or we can say general, visceral, afferent. And what are general, visceral, afferent? They will be carrying general sensation of distension and ischemic pain from viscera. Away from the sulcus limitans in the basal lamina there will be somatic motor, or we can say general, somatic, efferent. So general, somatic, efferent is those who are going to supply the striated muscle originating from the somites. Okay, so here away from the sulcus limitans on the alar lamina there will be somatic sensory, or we can say general, somatic, afferent. Okay, so you can see the general, somatic, afferent, these will be carrying general sensation of pain, touch and temperature from skin, and proprioceptive sensation of vibration and muscles and joint senses. So now till now we have seen 4 functional column, 2 in the alar lamina, 2 in the basal lamina. In the alar lamina those are motor, and in the in the alar lamina those are sensory, in the motor lamina those are motor, in the basal lamina those are motor. Okay, and close to the sulcus limitans there will be visceral. Okay, so you can say general visceral efferent, general visceral afferent. Away from the sulcus limitans there will be somatic motor and somatic sensory, so we can say general somatic efferent, general somatic afferent. So we got 4 functional column. Now at the same time there will be appearance of the pharyngeal arches. So for the pharyngeal arches the functional column will appear. So to supply the muscles of the pharyngeal arches there will be the motor functional column which will be appear here in between the general somatic efferent and the general visceral efferent. So it will appear here and that will be known as spatial visceral efferent. So you can see here that is spatial visceral efferent appearing between the general somatic efferent and here it is general visceral efferent. At the same time in the alar lamina there will be sensory column will appear which will supply the pharyngeal arches and that will be known as spatial visceral afferent. So spatial visceral afferent is appearing between the general visceral afferent and this one is general somatic afferent. Okay, so we got now 6th and 7th one will be spatial somatic afferent which will be for smell, hearing and balance. So now to summarize the functional column of cranial nerves, you can see in the basal lamina all are motor, in that there is general somatic efferent that is going to supply the striated muscles arising from the somoid. Then there is a spatial visceral efferent which is going to supply the muscle arising from the pharyngeal arches. So spatial visceral efferent. Okay, and third one will be general visceral efferent. So general visceral efferent will be going to supply the glands, smooth muscle of viscera and vessels and also preganglionic parasympathetic fibers. If we are seeing here in the alar lamina, so close to the sulcus limitans there will be general visceral afferent, okay, which will be carrying the general sensation of distension and ischemic pain from viscera. Then there will be spatial visceral afferent which will be carrying the spatial sensation of taste from the tongue. Then there will be general somatic afferent that will be carrying the general sensation of pain, temperature, touch from skin and proprioceptive sensation of vibration and muscle and joint senses. And the last one is spatial somatic afferent, that is a spatial sensation of smell, hearing and balance. So you can see in the basal lamina between the two general one spatial is there, and here in the alar lamina between the two general one spatial is there, and the last one is another spatial, that is spatial somatic afferent. Okay, so now if you see here, if we see general somatic efferent, so which functional column are going to supply the muscle arising from the somites? So you can see the extraocular muscles, the muscles of the tongue, and the here you see these both muscles of extraocular muscles and the muscle of the tongue, they are arising from the occipital somites. Okay, so they will be supplying by the general somatic efferent functional column. So what is their location? So in midbrain, that nuclei belongs to third cranial nerve, then fourth cranial nerve, sixth cranial nerve, that is present in pons, and in medulla, that is 12th cranial nerve nuclei. So the third cranial nerve, the third nuclei will supply the extraocular muscle, excluding superior oblique and lateral rectus. Fourth cranial nerve will supply superior oblique muscle. Sixth cranial nerve, this nucleus will supply lateral rectus, and this nuclei will supply all the muscles of the tongue except the glossopharyngeus. Okay. Now here you see spatial visceral efferent. I already told you spatial visceral efferent means that is going to supply the muscles arising from the pharyngeal arches. So you see the fifth nerve nuclei will be going to supply the muscle arising from the first arch. Seventh nerve will be supplying the muscle arising from the second pharyngeal arch. Ninth will be supplying for the third pharyngeal arch. 10th for fourth pharyngeal arch, and 11th for here, that is sixth pharyngeal arch. Then general visceral efferent. General visceral efferent means that is going to supply here the gland, smooth muscle of viscera and vessels, and preganglionic parasympathetic fiber. So Edinger-Westphal nucleus is concerned with ciliary ganglion. Then superior salivatory nucleus, inferior salivatory nucleus, superior salivatory nucleus for the submandibular ganglion, inferior salivatory nucleus for the otic ganglion, and the dorsal nucleus of vagus concerned with the here 10th cranial nerve. Okay, so that is parasympathetic ganglion present close to the heart. And here you see general visceral afferent and spatial visceral afferent. Okay, so general visceral afferent, that is carrying the general sensation, spatial visceral afferent carrying the spatial sensation. So you know already the anterior 2/3 of the tongue, general sensation by lingual nerve, and spatial sensation by facial nerve. Then the posterior 1/3 of the tongue, that is by 9th cranial nerve, and posterior most part of the tongue, that is by vagus nerve. And they all will be, their functional column is nucleus of tractus solitarius. Then there is general somatic afferent. Okay, so here general somatic afferent, that is mesencephalic nucleus in midbrain, sensory nucleus and spinal nucleus in pons and spinal cord belonging to the fifth cranial nerve, and cochlear nerve nuclei and vestibular nuclei present in the pons and medulla, they belongs to spatial somatic afferent. So now you can say in other way, if we talk about particular functional column, so to that functional column how many cranial nerve are related, or if we talk about one particular cranial nerve, to that how many functional column it is attached to. So for example, if we talk about the fifth cranial nerve, so fifth cranial nerve has what functional column? It has a spatial visceral efferent, because it supplies the muscles arising from the first pharyngeal arch. Also fifth cranial nerve has general somatic afferent column. Okay, general somatic afferent, general sensation of pain, touch and temperature from skin, and proprioceptive sensation of vibration, muscle and joint sense from the head and neck. So mesencephalic nucleus, sensory nucleus and spinal nucleus, they all are belonging to fifth cranial nerve. So fifth cranial nerve has two functional column. In the same way, suppose if we say 10th cranial nerve, vagus nerve, so it has the spatial visceral efferent, because there is nucleus ambiguous, which is for the muscles arising from the fourth pharyngeal arch, and here it is also having general visceral efferent, that is dorsal nucleus of vagus, because it is going to supply the glands and smooth muscles of viscera and vessels. Also The 10th nerve has functional column of general visceral afferent and special visceral afferent. One more example, suppose if we say abducent nerve. So how many functional column are there? So abducent nerve has this one functional column, general somatic efferent, and also it has general somatic afferent. Okay, then if we say the 8th cranial nerve, how many functional column are there? So it has only one functional column, that is spatial somatic afferent. Now if you want to see how to describe a cranial nerve, so cranial nerve should be described under following headings. What is the introduction about the nerve? What are the functional component nuclei, their location? What is the course and relation of the cranial nerve? What can be the branches and distribution? What is applied anatomy related to the cranial nerve or lesion of the cranial nerve? And if there is any clinical testing of the cranial nerve. So that is the topic of functional column related to the cranial nerve. Okay, these are the references, and thank you.